Hello, I am Megan Whorton, and this is Katie Sahlstrom, and we are both from the College of Osteopathic Medicine at the Cherokee Nation. Today, we'll be walking you through our preliminary research regarding the effects of PET therapy on blood pressure in the elderly population. The prevalence of hypertension is continuously increasing within the United States. And today, the CDC reports that almost half of the adults within the United States has been diagnosed with hypertension. The elderly population specifically faces an increased risk of developing hypertension due to social stressors such as decreased social engagement and activities. PET therapy has been shown to improve the social, psychological, and physical health of the elderly by filling in this psychosocial gap. Previous studies have indicated that PETs can decrease blood pressure results, but they tend to have smaller sample sizes. And they also focus on pet ownership or long-term therapy. Our goals of this research study is to determine if short-term PET therapy interactions can reduce blood pressure in elderly female-assisted living residents. And we would also like to establish a protocol for elderly people who would benefit from PET therapy but cannot have a PET. Our methods for this research study included 8 female volunteers who were currently living in an assisted living facility, and we had 2 groups. We had a control group and an experimental group. During both groups, we had a 15-minute visit with one of us, but the experimental group consisted of Cannoli, our pet therapy dog, which is pictured at the bottom of the slide. And our control group did not have Cannoli. It was only just one of us. We would manually take the blood pressure before the visit and then manually take the blood pressure after the visit.
Our results were pretty astonishing. Here we took the average of the 8 participants and we kind of divided up between pre-systolic and post-systolic, as well as pre-diastolic and post-diastolic. We concluded that a 15-minute visit with a therapy dog showed great decrease in both systolic and diastolic blood pressure. For systolic, it decreased by 3.44%, and diastolic decreased the pressure by 4.76% compared to those that were not exposed to a therapy dog. These findings confirm previous studies that utilize the use of animals to help reduce stress in humans. However, to our knowledge, this investigation is the first to really look at how a short-term or one visit pet therapy can affect blood pressure in the elderly females. This study can have a large impact and maybe change how medical professionals can treat and approach the elderly patients. The next steps that we would like to implement to help improve our results and our study is to utilize a stopwatch. We have not been doing this, which may have led to some human error, and the stopwatch would help more formalize the 15-minute time that we set up. And then we would also like to include both male and female participants, not just females, as well as gather some data from Native Americans for kind of a comparison study and ethnic differences. However, we are currently waiting for approval, and we're also keeping an eye out on the COVID cases currently, so we can ensure the health of both the investigators and the participants. The future goals of this study is to provide a larger sample size to improve our accuracy and hopefully be a place that other studies can kind of draw from as well. And we hope to incorporate different participants from various nursing homes and elderly day centers. These are the references that we have. And we would just like to thank Dr. Jones, our research mentor, for helping us along and for kind of showing us the ropes of research. And we would also like to thank Heritage Grove for allowing us to come and provide us some of the participants that we had in this study. We thank you for your time.